Hello, ZeroDiabetes Zone family. Welcome back to our channel where we provide you with the best diabetes-friendly content. Today, we're diving into a topic that's often overlooked, but incredibly important: diabetes and sexual health. Let's talk about common issues and how to address them. Living with diabetes can impact various aspects of your life, including your sexual health. Both men and women can experience challenges, but the good news is that these issues can often be managed. So, let's break it down. First, let's talk about men. One of the most common issues men with diabetes face is erectile dysfunction, or ED. This happens due to poor blood sugar control, which can damage blood vessels and nerves responsible for erections. Other issues can include reduced libido and lower testosterone levels. It's crucial to keep your blood sugar levels in check and talk to your doctor about any changes you notice. Now, for women, diabetes can lead to vaginal dryness, making intercourse uncomfortable or even painful. This is often due to poor blood sugar control affecting blood flow and nerve function. Women may also experience a decrease in sexual desire and difficulty achieving orgasm. Again, maintaining good blood sugar control and discussing symptoms with your healthcare provider is key. So, what can you do? Here are some tips for managing sexual health issues related to diabetes. Number 1. Maintain blood sugar levels. Keeping your blood sugar levels stable is the first step in preventing and managing sexual health issues. Number 2. Communicate. Talk openly with your partner about your concerns and how you're feeling. Number 3. Consult healthcare providers. Your doctor can provide treatments and strategies to manage sexual health problems. Number 4. Healthy lifestyle. Regular exercise, a balanced diet, and quitting smoking can improve overall health and blood flow. Number 5. Medications and therapies. There are medications and therapies available that can help. Don't hesitate to ask your doctor about these options. Remember, sexual health isn't just physical, it's emotional and mental too. Diabetes can cause stress, anxiety, and depression, which can also affect your sexual well-being. Seeking support from a counselor or therapist can be incredibly beneficial. Thanks for joining us today on ZeroDiabetes Zone. If you found this video helpful, please give it a thumbs up and subscribe to our channel for more diabetes-friendly content. If you have any questions or topics you'd like us to cover, leave them in the comments below. Take care of yourselves and see you next time.